Hi, I'm Dr. Sanjeev Jain. I'm a professor of psychiatry at the National Institute of Mental Health and Neurosciences, Bangalore. I work on the genetics of psychiatric disorder and the history of medicine and mental health in South Asia. The pandemic has obviously raised many of these questions together, and that's what has been interesting us for the last several months while we face this pandemic. The three main things that we have been worrying about is that why do we forget how we have responded to epidemics in the past, and why haven't we learned the lessons that we should have or could have? First thing about forgetting about what we have learned as a society to respond to epidemics. Human society and human culture has evolved basically as a response to disease, because every known civilization battled epidemics of smallpox, plague, cholera, typhoid, various flus and miasmas, and how people responded and how cultures respond to this has driven human society. And much of the early work on how epidemics are to be understood and controlled was done in India, whether it was Robert Koch in Calcutta or Ronald Ross in India, in Bangalore and Hyderabad and Calcutta and all over southern India, and the whole edifice of public health engineering, which helped us understand how to live and control these epidemics. Much of this work was done about 100 years ago and changed the face of modern medicine. So therefore, a new epidemic should not really have perturbed us, because the essential tools of contact tracing, of doing the biology, of understanding what prevention is unchanged for almost 150 years. However, all this was done during the period of colonial rule, and sometimes we choose to forget whatever we learned and, in a sense, throw away the baby with the bathwater, that was a foreign science and we need to rediscover and do everything ourselves. And in all this response to an epidemic, what do we lose as a society and what do we lose as a social construct, as a society? Health, maintaining health and preserving health is perhaps the most important function of society. After all, the society is supposed to look after those in distress. So when people fall ill, then ensuring that they get proper care unreservedly and are assured that they will get help in whatever circumstances they are, and becomes very, very important. At this time, with the pandemic, when danger lurks almost at every surface, with every contact, and people are urged to isolate and move long distances to seek help, it somehow strikes at the root of the social contract, and that becomes a very serious problem for the long-term stability of society, because health and safety are the basic bedrock on which civic society is based. There's also the long-term consequences of what this infection and this pandemic could have on individuals and societies in the not too distant future. Now, the virus that we are facing now is a variant of the influenza virus, which had a huge epidemic, as we all know, in 1918. But the long-term consequences of that still remain to be understood. Of course, in India, we lost almost 20 million people. We lost the entire population for an entire decade. And this had huge impact on the economy and the land distribution and the way we managed ourselves for the next several decades. On the other hand, the influenza epidemic also resulted in a spike in patients with schizophrenia. Now, those are things that emerged only 30 to 40 years after the epidemic. So we would need to keep track of all this in the future. The immediate consequences of delayed changes in the way the immune responses work, the social consequences of penury, of the increased cost of healthcare, and the driving down of the economic safety net would also have immediate consequences on health, as would be the diversion of almost all routine healthcare into COVID care. So all the other services, for example, cancer care, hypertension, diabetes, chronic mental illness, all these things have taken a bit of a backseat. And the consequences of that would also need to be considered in this follow-up period. So in short, understanding the science and the social science behind disease should guide our responses. And none of these are very complex. We know a lot about viruses, we know a lot about immunity, and we know a lot about how these diseases spread. So there is no reason for us to feel threatened or overwhelmed by this elusive enemy. The application of science and the proper application of social medicine would help us tide this crisis reasonably successfully. I do hope that.